Hi, I'm Clarissa and I'm a student nurse. Today I'm here with my patient who has a venous stasis ulcer to the right leg. Basically, a venous stasis ulcer is caused by a deep vein thrombosis or chronic incompetent valves within the deep veins. Today our patient has been complaining of pain in the lower leg half area that is aching and worsens with prolonged time of sitting or standing, and especially during the later hours of the day. On top of that pain, she is suffering from stasis dermatitis, which is causing a lot of itching to that part of the leg. She does have edema to the right lower part of the leg that is firm, brawny, and coarse and thickened. Her pulse is remaining normal at this time. Basically, to sum it up, our patient has poor circulation to the right leg. The blood is not going to where it needs to go, which would be back up to the heart, and this is due to an insufficiency of valves. This causes fluid to leak out of the veins and into the tissues, which in then turn causes the ulcer to form. So just a little background of my patient. She's 33 years old, female, Asian, weighing 320 pounds. She lives in rural Florida with her family, and she is currently unemployed and disabled. After all her bills are paid, she is only left with $150 a month, and this would be like her groceries, expenses, etc. So we gathered that after calculating her BMI, which was 53.2, that our patient suffers from obesity. We think that this could be due to the small budget that she has left over for buying groceries. $150 is not enough to go a whole month buying healthy items and whatnot. So we think that she uses this money, she buys what she can afford, and typically those items are not the best health-wise. So it's our job to come up with a diet plan that fits her budget, as well as her cultural aspects, being raw fish, vegetables, and rice. And we could even substitute rice for brown rice. And just we want to make healthy alternatives that fits her budget and is cultural specific for her. We also think that maybe this obesity could be due to her being disabled, and maybe she fears that she can't exercise, or maybe she doesn't know some exercises that she can perform at home and that she doesn't need a gym membership because we know that she can't afford one. So we want to come up with an exercise plan as well for her that she can do right at home. When doing any kind of assessment, we want to remember that eye contact in this culture is seen as a sexual invitation. So we really want to be aware of that, and we want to watch that. We don't want our patient to feel uncomfortable. Also, we want to be aware of her head nodding. Head nodding is big in this culture, and it does not mean that she understands. So it's our job as health advocates that she truly understands, and we can do this by teach back method and so on. In this culture, illness is seen as an imbalance between the yin and the yang, the hot and the cold theory. And so with that being said, we want to make sure the yin and the yang is balanced, and we want to get her healthy. Hi, I'm Christine Carrera.
Hi, I'm Jalen playing Amy Wong. I'm Gabriel Monterey.
We're going to go ahead and begin our assessment.
Okay. Alright, so I washed my hands, gathered my supplies, all the critical elements. Knock, knock. My name is Gabriel, I'm a student nurse at Ulcer College. I'm here to perform an assessment on your legs. Can you say your name and date of birth for me? Amy Wong. Or how old you are? 33 years old. Okay. Are you experiencing any pain right now? Yeah. In your right leg? Okay. What kind of, on a scale of 0 to 10, 10 being the worst pain, 0 being none, what would you rate your pain? Like a 8. 8? Okay. What kind of pain is it? Throbbing. Throbbing pain? Okay. And then you said it's in your left leg? Right. Right leg? Okay. Right. Right leg? Right. Okay. Alright. So I'm just going to go ahead and be assessing your legs and checking what you have going on. Is that okay? Can I start? Yeah. Okay. So first I'm going to be checking your pulses here. Just going to go ahead and feel behind your leg here. Popliteal, posterior tibial, dorsalis pedis. So I'm just inspecting. Upon inspection, I see that the hair has even distribution. There's no shininess, or the color is coarse and brawny. And I do note that there is an ulcer back here. The margin is irregular and shallow with partial thickness. It's ruby red with yellow slop. And I would go ahead and measure the wound, measure all the borders and the depth. So basically just going to be inspecting it. Is it tender around the wound?
Yes.
Yeah, it hurts when
Yes.
I touch it? Okay. Okay. Can you go ahead and move your knees? You have a little bit of range of motion. Excellent. Okay, so basically to get this figured out a little bit, I'm just going to go ahead and tell you a little bit about your diet, what you should be doing. Go ahead and change your white rice. Try to eat brown rice instead. Just a simple change can increase your fiber. It's going to help promote a little bit of weight loss, which should help out with your leg. Try to eat some salmon. They'll increase your protein and promote that wound healing, which is going to be important as well to get that healed. And try to drink some orange juice. It's going to be high in vitamin C, which is going to help improve blood flow as well. Do that, and if you can try to get some exercise, maybe you can walk around your neighborhood. If you don't want to get out of your house and walk around, or if it's too hard, you can maybe do some leg extensions or leg lifts and things like that to help exercise as well. Okay? Any questions for me at all?